Welcome to Your Anxious Child, 5-Minute Solutions, a podcast dedicated to providing practical advice and support for parents of anxious children. This advice is informational in nature and not a substitute for a consultation with a licensed mental health professional. And now, here's your host, Dr. Edward Plimpton.
Welcome back to Your Anxious Child, 5-Minute Solutions and Interviews with Experts. Meredith Elkins is a clinical psychologist who is on the faculty member of Harvard Medical School and is the co-program director at the McLean Anxiety Mastery Program at McLean Hospital. And she has just written a book, which I am rather excited about, Parenting Anxiety, Breaking the Cycle of Worry and Raising Resilient Kids. So, congratulations on your book, Meredith.
Thank you so much. I'm so happy that it's out in the world.
Right. Is there anything else you'd like our kind of audience to know about you before we jump in and start talking about your book?
I think I'd love to share with the audience that, I'm a parent myself and that parenting in 2026 is a necessarily anxiety-provoking experience for so many of us. And so I think that my goal with the book was to answer the question, what is everything a parent needs to know about anxiety? If you are anxious yourself, if you have a child who's struggling with anxiety, what's everything that a clinical psychologist wants you to know? And so in the book, I really address what anxiety is and what it isn't. What are the factors that make it better or worse? And I really highlight that this is a book for parents who are struggling with clinically significant anxiety, so an anxiety disorder, or whether it's the anxiety that just comes up as part and parcel of living in 2026. And so I hope it's broadly applicable and that it'll be helpful for folks.
It certainly is a very kind of comprehensive book, and I think you really cover a lot of territory. On so many levels, our words kind of define our experience. And language is so important in communicating, especially with kind of, children around these things. And, the term I'm anxious is no exception. And you start off your book, tackling this issue. And I wonder if you could just talk to us about, how we can use that term, I'm anxious, and what does it all mean?
I think we are starting off when we're managing anxiety at a little bit of a disadvantage because we use colloquially the term anxiety both refer to the clinical diagnosis, right, an anxiety disorder, and the normal natural feeling that we all experience as part of being human. And so I think we are able to differentiate between sadness and depression, but our language sort of handicaps us because we're not able to distinguish as clearly between when we're talking about normal anxiety and clinical anxiety. And I think that necessarily means we're more likely to over-pathologize the experience of being anxious itself. So you're right, the language that we use really shapes how we see the world. And we're already there at a little bit of a disadvantage. I wish we could come up with something a bit more nuanced. Maybe we'll get there someday.
But, what you're saying certainly occurs to me kind of on a weekly basis of, a parent saying, their child is anxious. And it's not really clear in terms of whether it's kind of a normative, expectable kind of anxiety, or whether it reaches kind of, something that really demands kind of more careful attention.
Right. And I think that a really important place to start for parents is to help empower parents, educate parents to understand the difference between normal anxiety and clinical anxiety disorders. Because if we as parents can express that to our kids, then we're all on the same page. So if parents can recognize that the experience of anxiety doesn't mean that you're broken. There's something wrong with you if you feel anxious. And we expect that we are going to feel anxious at certain points in our life, so at certain points, throughout the academic year, certain times based on whether or not we're coping with illness or coping with a stressor. These are normal and natural reactions. But if we're talking about anxiety as always bad and something that always needs to be nipped in the bud, then the mere experience of it makes us all feel like something's wrong with us. And we're going to approach it as a crisis to be mitigated rather than an experience to be coped with. And so I hope that the book can help clarify the distinction between the two.
Well, you point out in your book that our biology requires us to be anxious.
Our biology definitely requires us to be anxious. I do think taking an evolutionary point of view here is so important. So when I'm working with kids and parents, and we talk about how our early human ancestors, we all needed some anxiety to keep us safe. Imagine, a group of early humans around a campfire in the wilderness where everything beyond that campfire was, dark and scary and dangerous, and there's predators and there's, warring tribes and all sorts of these primal terrors that our ancestors had to cope with. Think about how painful the experience of anxiety had to be, how uncomfortable it had to be to motivate our ancestors when they heard something in the bushes to get up and flee from the safety of that campfire into uncertain circumstances, right? Is it safer to be there or do you need to flee? Anxiety feels deeply uncomfortable. It had to in order to keep us all safe. And now in our modern era, where thankfully we are so much less likely to be, devoured by a predator or set upon by roving bandits, we still feel that really uncomfortable experience when somebody's making fun of us in our peer group, or when we get an email from our manager and makes us feel like they think we've done something wrong. We still have the same early human kind of hardware, but our circumstances are so different. And I do think that once parents and kids understand, oh, this feels awful because it was meant to feel awful. Me feeling anxious feels awful because it motivated the fight or flight that kept us safe. That really, in my experience, has helped parents and kids reconceptualize what anxiety is and know that your body is actually meant to be able to tolerate this. Like, you are built to be able to handle the surge of anxiety, the surge of discomfort, your heart beating quickly, your palms sweating, feeling like you're choking or feeling like you're dizzy. Your body's actually built to be able to cope with that. And so when we pathologize it as like this is something deeply wrong just by the mere experience of the feeling, we're already coming at it at a disadvantage.
Well, we may use a computer analogy to talk about the brain. Our brain, it sounds like what you're saying, has not gotten very many updates, shall we say. It's still kind of caveman 101, shall we say.
It's caveman 101, absolutely. And I'm certainly not the first and not the last person, in the field to recognize that. But I think that sharing that conceptualization with kids and parents makes it more digestible. And, even just to kind of pull on this thread a little more, a panic attack is the purest experience of our fight or flight response, right? So what happens during a panic attack? It is a short term, typically peaks within 10 to 15 minutes, rush of the sympathetic nervous system. So everything from your heart beating really quickly, like I said, difficulty with breathing, feeling like you're choking, trembling, sweating, hot flashes, cold feet, all of like stomach distress, all of the discomfort that we have when we experience a panic attack. Again, this motivated the fight or flight that we needed to stay safe. So when we're working with kids or adults who are struggling with panic, one of the things that we're actually doing in treatment is practicing bringing on the experience of a panic attack in session. And we're doing this not because we're these sadistic therapists who like torturing our patients, right? We're doing it to show the patient that you can actually tolerate the feeling of discomfort, that this isn't actually going to hurt you. It is uncomfortable, but it is not unsafe. So we will do what we call interoceptive exposures, trying to mimic the experience of panic. So having people hyperventilate until they feel dizzy or feel like they can't catch their breath, breathing through a coffee straw, which, feels really overwhelming. You feel like you're not getting enough air. You get dizzy, you get hot, you get a headache. It's unpleasant, but it's tolerable. Or spinning around in an office chair until you feel dizzy and nauseous. And again, we do this because we want folks who are in treatment with us to understand you can experience this feeling and it will be like a wave. It will rise, the feeling will rise, it will crest, it will plateau, and it will eventually decrease and you'll get back to baseline. You can handle it without running to giving into the urge that anxiety pulls us to do. So whatever we may be doing because of panic, like limiting our life, not seeing friends or family, not going out of the house, leaving school early. And this is so empowering. Once we recognize that we can actually tolerate that physical distress associated with anxiety, that opens so many doors for us. But we need to stop thinking of the physical experience of anxiety as something damaging, something dangerous, and instead think of it as something that we're all meant to be able to tolerate. It's easier said than done. I understand that. And we were meant to be able to handle this.
Well, you invoke biology, but there's another part of biology that I think you need to respond to, which as parents, our biology is that if there's distress, we're to provide comfort.
Absolutely.
So, that's what we're wired for. And, all of the changes that occur around, pregnancy for moms in particular are geared to make you extra sensitive to signs of distress in your infant. So, so how do you factor that into the equation?
It's very much part of the equation and something that I'm so glad you brought it up because it is something so worth noting. So we go back to our caveman history when we're talking with parents. We are all primed to respond with our own distress when our child is distressed. And I smiled to myself when you were saying, parents are innately primed to respond to their infant's distress. I remember once my daughter was born, the brain changes showed up for me so much that I could no longer watch Game of Thrones. Like anything that was painful, where people got hurt or were psychologically tortured or like bad things happened to children, it was just off the table for me for several years. Again, this is so adaptive. Like we are wired as parents to be really reactive to our children and so that we keep them safe in situations where, most children didn't live past the age of 5. It was so dangerous. What's happening in the modern era is that the distress that we feel as parents when our child is distressed, when it is a normal and safe situation, is kind of hijacking that really adaptive process. So it is pulling for parents to jump in and minimize distress at all costs, even for situations that, while uncomfortable, are actually necessary for our kids to grow and thrive. And I think that this is where our modern parenting culture is playing such a big role because not only are modern parents dealing with their child's distress, and their own distress because their child is distressed, but we also have our parenting culture whispering in our ear, you're a bad parent if you don't move heaven and earth to make sure your kid isn't struggling right now. And anxiety is really taking advantage of that and just hijacking that and having a field day with kids and parents right now.
So in your book, you kind of label that as the kind of the cultural uh, theme of intensive parenting in our age. And I wonder if you could just talk a little bit more about, intensive parenting and how that, well, it has its good points, may also fuel anxiety.
Sure. I think it's a really important and under discussed piece of the trends that we're seeing where child and adolescent anxiety is increasing and parent well-being is decreasing. I think a big piece of this is our parenting culture. Um, and, the sort of recognition of the parenting culture and its impact on anxiety happened to me in a very personal way as the book was first starting to take shape. It was a really challenging moment for me, both as a parent and as a psychologist. And funnily enough, it started with Irish step dance. We live, I know you're in Western Mass, we're on the South Shore of Massachusetts. It is called the Irish Riviera, and everyone, there's a lot of Irish step dance around here. So, naturally, when my daughter was 3, we took her to a brewery on St. Patrick's Day, as all folks on the Irish Riviera do. And she saw some Irish step dancers and she loved it. And she wanted to be signed up for it. And she was so excited. And then on the first day we went, she panicked and she wouldn't go into the studio. And this was a total curveball. I hadn't been expecting this at all because she had been so excited about it. But she panicked and she refused to go in. And in that moment, you think, because I treat anxiety for a living, like I would have absolutely known what to do. This would have been my finest moment. I would have had so much confidence. But in that moment, I actually realized how vulnerable I was to the message that we have been fed, particularly on social media, that her discomfort was actually unsafe, and that if I didn't pull her from Irish Step immediately, that I was, I was going to be the author of her childhood trauma, or I was, creating a fundamental attachment injury and she'd never recover from it and our relationship was doomed. All of these things that keep cycling through parent social media made me really second guess what in my core I knew was right. I knew, because I specialize in providing exposure therapy, that discomfort is often where the learning happens, and facing fears with support is how kids grow. So in this moment where I had to decide, do I put my exposure pants on? Do I treat her in the same way that I would treat a patient who was struggling in this situation? And again, I've seen so many families where anxiety first got a foothold in situations like this, where anxiety increases in the kid, parent distress increases, and so they pull the kid from the situation that's making the child feel uncomfortable, and everybody feels better in the short term. But then the next time a similar challenge comes up, it's even harder to face. So I knew that, but I really second guessed myself in the moment. And so that actually led me into more research in sociology, which, is not something that clinical psychologists are often looking into. And I wish we did more now, but I recognize the concept of intensive parenting, which was really defined by Sharon Hayes back in the 90s as, this is what idealized parenting looks like in much of the Western world. And it's this sense that parenting is that the child is absolutely precious and sacred and needs to be protected by adults in their life from society, from all of the dangers that are around them. And so the ideal parent parents intensively. And so it's been studied as intensive parenting includes a number of things. So first, parents should always follow their child's lead in the intensive parenting, under the intensive parenting umbrella. So, if a child doesn't want to do something or feels uncomfortable, the parent, the intensive parent follows the child's lead. That parenting is a emotionally absorbing experience. So the child's experience is the parent's experience, and good parents are fundamentally linked emotionally with their child's experience. Intensive parenting is also labor intensive. It is financially expensive, and it is expert driven. And it is driven by the sense of this moral obligation that parents have to parent in this way for their kids. Once I started recognizing, okay, this is the narrative that has gone on hyperdrive. There's articles that have come out saying we are seeing the intensification of intensive parenting in the 2020s. And so this is unsurprisingly linked to the fact that the Surgeon General has identified intensive parenting culture as one of the factors that has contributed to declining parental well-being in the past several years. So, what a hard situation for modern parents to be in. Your child is in distress. You are in distress because of, like you said, that biological, natural, normal, adaptive biological instinct to help our kids. And our parenting culture is saying if you don't move heaven and earth to make sure that your child is no longer feeling distressed, that you're a bad parent. I was surprised how vulnerable I was to that experience. And this was right as the book was taking shape. And I was like, I need to explore this more. And so a lot of the book is looking at how that intensive parenting narrative is driving parents to feel like they need to prioritize short-term comfort over long-term resilience and confidence. And I'm hoping that this will help us shift the conversation and break that cycle.
As a note of kind of compassion to parents with regard to that, you also kind of make the point that, we tend to flip-flop between
Yeah.
softy parenting and tough guy parenting, or I guess it's faux um, faithful parenting.
Yeah.
You know, F around and find out versus kind of and you kind of make the point that, parenting tends to flip-flop between these two extremes when there isn't more societal support for parenting. And we really in the United States, there is really very little support for kind of parenting, in terms of structural
Yeah.
societal support. So, in a way, it's not surprising that we have this flip-flop in extremes.
Absolutely. And I think it's also really important to note that when we are stressed, we tend to get less psychologically flexible. So we sort of pull for short term solutions, we pull for kind of extremes in our behavior. And so often as parents, we have the experience of, I open the book with a description of my friend Heather, who asked if I'd grab coffee with her. She wanted to talk with me about her son, who had been struggling with some budding potential anxiety disorder concerns. And she talked about this experience where he was struggling with some homework. And so she started off in more of the, I think you would call it the gentle parenting side of the equation, where she's, validating his experience and engaging with him warmly and, trying to support him there. But he's just getting more and more frustrated and anxious. And everything she's suggesting isn't landing. And then all of a sudden, she kind of a switch flips. And she's like, fine, like figure it out yourself, and storms off. And then she feels awful because she didn't want to like lose it on this 8-year-old who just was struggling in the moment. And so then she's coping with her own shame and guilt, but still not knowing how best to help her son in the moment of anxiety. And so many parents of the young people with whom I work who are struggling with anxiety note that they will ping pong between, like you said, like the kind of softy parenting, the validating, the warmth, the nurturing, or the, get your skates on, this shouldn't be this difficult, like, come on. And what we know from the research is that either the overparenting side or the under support side is actually problematic for child anxiety. We see child anxiety increase when there is either overparenting or under support. And to your point about a compassionate message for parents, we don't need one or the other. Actually, what we see as the best approach is this middle path that has both warmth and validation and compassion for your child's experience and their feelings, with setting firm but compassionate limits around how much anxiety can be driving the bus in the household. So it doesn't need to be gentle parenting or FAFO parenting. We can take the best of both. And what we really get is more akin to authoritative parenting. And we've known for decades that this is the parenting style that's associated with the best outcomes for kids. It's
So,
warmth with limits.
so why is authoritative parenting so hard to do?
I think it's hard to do because of our own stress. because again, it is really adaptive for us to become less psychologically flexible in moments of stress, for us to make quick decisions without a lot of rich contemplation. And so this is why when we get stressed, we are more likely to snap at our loved ones, or to binge the sleeve of Oreos, or to kind of do the thing that is sort of values inconsistent because we are stressed. And so it can be really challenging to parent in a middle path balanced way when kind of our own stress and anxiety pulls us into either under supporting or over parenting in the moment, because those are kind of the less psychologically flexible approaches. It makes so much sense. And I do it too. When I feel stressed, when my when my cup overfloweth, I feel like I'm not parenting, authoritatively. I'm not parenting from my best self. And again, that can feel so hard for parents because you're like, gosh, and this is where you see, understandably, everything about co-regulation, right? I need to be regulated as a parent to be able to be my best, to parent in the best way. And this is true, and it's a really tall order.
Right.
So,
Right.
this is hard stuff. If it were easy, we wouldn't be having these conversations, right? Because we would have all figured it out, present company included.
No, there's so many kind of challenges between validating a child's feelings,
Mm.
because to be anxious is to feel alone, to validate those feelings, but to not give those feelings undue importance, not
Mhm.
to kind of treat them, um, to recognize them, but also give recognition that they are transitory in nature.
Mhm.
Um, kind of so challenging to kind of strike that balance.
It is really challenging to strike the balance, and I think one thing that makes it easier for parents to strike that balance is if you truly believe that the experience of anxiety, right, the painful thoughts, the painful feelings that make up anxiety is not actually dangerous. If you as a parent know it is normal, natural, harmless for me or my child to be experiencing this, then you can navigate it with more confidence. And it also opens the door to being able to be more compassionate because you understand. Of course your child is struggling. Like something brought this to mind about a year ago now. We went and we were looking at open houses. My husband and my daughter and I. She was bored, so I told her to wait in the car, and we were there for a long time. And about 30 minutes later, she came to the door and she was tearful. And I went outside with her, and I was, "What's going on?" And she had been sitting in the car, and she was like, "You said you would be back in a few minutes." She was like, "I thought the realtor had kidnapped you." And so she sat there waiting, and in terror, it's like, "Okay, mom and dad are kidnapped by the realtor, and if I go in, I might get to kidnap too," right? So she was so anxious, and of course, we know that that's absurd, that we would be kidnapped by the realtor. And in the moment, that's the way her little brain was working, right? And so it makes so much sense that she felt anxious. It made so much sense that if she had those thoughts, she would feel anxious. And it's not a true thought. It's not a true feeling. And so what we were able to say is that makes so much sense. We're safe. We're going to go back in and finish up, because we know that she's not in crisis just because she had a validly anxious experience in a situation where the concern is invalid, right? That's a learning moment. Now she knows realtors don't kidnap parents. But her fear was real, and I think that that's important. So when you have a child who's struggling with any type of anxiety, parents asking themselves, why does it make sense in this moment that you feel this way? Allows us to validate with compassion and then express confidence in our kids' ability to do the hard thing despite the anxiety.
And you're also providing a context to place their feeling,
Mm.
because she has the feeling somebody's going to kidnap them. You come out and you validate the feeling, but you also provide the kind of context that, you know, that's not a realtor's thing, to kind of kidnap,
Yeah.
nice parents. And
Even not nice parents.
Right. Yeah,
Right.
even not nice parents.
Right.
Um,
And
you
we
know, and
didn't pull the pl we again, if we had been like, "Oh my gosh, she's upset, so we need to hightail it out of here." Again, what would that have taught her? That teaches her that her feeling and those thoughts are the most important thing in the situation, right? Rather than the reality. So if we came out, we saw she was upset, and of course, I felt awful that she was upset. I didn't want her to be upset in the car. Um, and we didn't cut and run immediately as a response to this. Because then again, that punctuates her an understanding that she'll develop that feelings are facts and thoughts are always the truth. And we know that that's not the case. Feelings are feelings. They can be painful. Thoughts sometimes are true, but not always. And we do ourselves and our kids a real disservice if we give them celebrity status all the time. And I'm sorry I cut you off.
no, not at all. She, to kind of negotiate authoritative parenting, it seems to me made the kind of point that one of our superpowers as parents is the capacity to develop mindfulness, which is to say the capacity to kind of observe your child, to be kind of present, in the moment, to be able to observe them as essentially a parental superpower. And Jessica Gross, the New York Times columnist, has kind of suggested that, you know, it's probably the most important kind of parenting skill is the capacity to kind of observe. Because if you can do that, then you can kind of notice in front of you. And this little creature who's constantly kind of changing from a caterpillar into a butterfly, that is perhaps one of the most important skills you can have, or which is essentially, kind of mindfulness.
I agree with that, and I love that Jessica Gross has put that out there. I mean, she's such an important voice in parenting. I talk about in the book, I talk a lot about the concept of psychological flexibility, um, and it's sort of a mouthful, but it encompasses mindfulness in such an important way. So, psychological flexibility is the ability to notice what's going on for you in the present moment without judgment. So the joy, the pain, the discomfort, anything that's going on for you in the present moment, and then to pause and then make a choice to act in a values consistent way, right? So it is a huge part of this is that mindfulness is the practice of being able to notice what's going on for you, notice the feelings, the physical feelings and the emotional feelings that are at play, notice the thoughts that are driving those feelings, but to not be necessarily hooked by them, and instead to be able to make the choice to act in accordance with them if we want to, if that's in line with our values, or to do something different. And where psychological flexibility comes into play so much with anxiety and parenting is if you know as a parent that avoidance fuels anxiety, right? The more you kind of permit your child to avoid the things that make them feel uncomfortable, that helps anxiety in the short term, but in the long term, it erodes their confidence and capabilities. Then in that moment, where your parenting instincts are telling you, your kid's distressed, you need to stop this, you're a bad parent. You can notice all of that that's going on for you and pause and make a choice to validate your child's feelings, compassionately connect with them, and say, we're not going to let anxiety drive the bus here. What is one thing we can do to push back in this situation? So, you know, in my situation with the realtor kidnapping, it was, we're not going to run away right now. Like mom and dad are going to finish this conversation, and we're okay. We're going to leave in a bit. In the Irish step situation, it was awful. I took her every week until she went in to the studio, and I got a lot of side eye from parents because she was upset, and I was kind of holding it together. But eventually, she learned that this wasn't dangerous. And she's literally been river dancing around my house ever since. So, again, but if you just give in the moment to, I feel distressed, she feels distress, my culture tells me I'm a bad parent if I don't make this my primary focus, then we are going to do the thing that is values and consistent, and we're going to erode resilience over time. It all starts on this core of mindfulness, as you said.
And I think it's also important to kind of note that in terms of kind of dealing with our children, that reading somebody else's kind of nervous system in terms of what they're up for and capable for is not always such an easy thing to do, which is to say we're not always going to kind of get it right. And that's okay.
Right.
We need ourselves to give ourselves permission to be mismatched, to not always get it right. And that equally important in terms of kind of relationships is the capacity to kind of repair things when things, oops, misgauge that one, to repair the kind of relationship. So not that you're not supposed to kind of get it right all the time, but if you're observing and watching, you're going to have a better chance to know what's going to work and also to know when, whoops, this is not working and it's backfiring.
I think the humility to be able to come to your kid and be like, I would like a redo on this one. I'm sorry, that was not my finest moment, you know, and to show your kid that you can apologize, that you can kind of reframe, that you can ask for a redo. I think that models a kind of a taking responsibility for our feelings and our actions in a way that I think is really productive. So I love the concept of a repair. And I think that the kind of self-compassion that goes with that is really important. So that's definitely something that I think modern parents are doing really well, is being able to have the make the space for that repair instead of just like, I'm the parent, and so whatever I say, even if it's, you know, completely unproductive, is gospel.
So in addition to kind of talking about the kind of cultural context, you actually then, also shift in terms of the specifics of how we do kind of, exposure and response prevention therapy, which is really kind of cornerstone to all treatment of anxiety, even though they may kind of call it somewhat in different terms, but it's cornerstone. And I wonder if you could explain about what is the therapeutic action of this type of treatment? Why does it work?
That's such a great question. I'm excited to get into that more. And to your point, I think the book is divided into three different parts. The first part of the book is really exploring and better understanding the experience of anxiety, what it is, what it isn't, what makes it better or worse. The central section of the book or the second section of the book addresses the way that intensive parenting culture is sort of feeding into this. So we've always had anxiety. Why is it different now? And what can we do about it within this culture? And then the third section of the book is exactly as you say, this gets into the nitty gritty of what the gold standard, most evidence-based approach for the treatment of anxiety is, which is cognitive behavioral therapy with an emphasis on exposure practices, and how it works, and kind of all of the support skills that you sort of need around that to make sure that it works as best as it possibly can. Exposure, in a nutshell, recognizes um, that anxiety pulls for us to avoid what feels uncomfortable. That's a very natural thing, right? We avoid people, places, situations, smells, like anything that we don't like. We're very good at avoiding this. And in the short term, that's great. But in the long term, avoidance teaches us that the only reason we felt better was because we didn't actually engage with the thing that was uncomfortable, and that we're not capable of handling that. And so paradoxically, that actually increases our anxiety and distress the next time we encounter something similar. So exposure recognizes this and turns it on its head. And so the core practice of exposure therapy is gradually engaging with the situations and even the feelings themselves that make you feel uncomfortable. Because we know that gradual, planful, thoughtful exposure helps us to kind of build a bravery muscle. So, how it works is very analogous to a good workout routine. If you are going to go to the gym and you lift weights and they're not really heavy, you're not really feeling anything, you're not sore the next day, you probably didn't really get much out of your workout. On the other hand, if you try to lift something and you tear something, you're never going back to the gym, or at least not for a really long time. So what we're looking for in exposure is a situation that we can challenge the patient to engage in that brings up a comfortable level of discomfort. Something where anxiety is saying, you can't do this. And you're saying, I, I don't want to, but I can. And once, so in the book, I talk about, I introduce how I did exposure work with an adult patient of mine named Marta, who I was treating during the COVID pandemic. She had just had a new baby and she developed panic disorder. And her biggest fear was that she was going to be panicking while she held her son and drop him or hurt him somehow. And so over time, so naturally, if she was afraid she was going to hurt her son, she avoided him. She didn't want to avoid him, but anxiety was driving her to feel like you're not safe around him. So she became increasingly dependent on her husband to take over. But her panic just got worse and worse, right? The more she avoided him, the more anxious she got whenever she was closer to him. And so we started doing this exposure work to having her hold her son, be with her husband moving gradually further and further away. The goal of exposure there is for her to learn that even though this feels uncomfortable, even though I am panicking in the moment, my worst case scenario isn't going to come true. I'm not going to drop him. I'm not going to hurt him. Even if I did, he's probably going to be okay, right? We need to have that discomfort in order to have the lesson be truly learned. And so sometimes exposure can be effective. Often exposure can be effective even if we don't habituate, even if we don't actually do something until we feel better in the moment. By learning that our worst case scenario doesn't happen or doesn't come true, or that if it does, we can handle it, that creates new neural pathways in the brain that help us to fight back against anxiety. This is why exposure is so effective. I joke with families who are coming into our program at McLean. I say, I wish we were a spa. We are not a spa. You and your children are going to probably feel more anxious in our program before you feel less anxious. And that's because you're doing it. That means you're doing it right. That means you're actually engaging with anxiety in a new way that feels uncomfortable, and you're getting stronger, just as you would if you were starting a new workout routine. It's hard, and it works,
Yeah.
partially because it's hard.
So, additional clarification, please. People get on airplanes who are afraid, and they don't really habituate to it. They come back the next time and they're taking an extra drink during the plane flight or a little Xanax or something like that. So you can be exposed to something, but that isn't necessarily doing what you're talking about, is kind of learning from experience. And how do you kind of make sure that someone learns from the experience?
Great question. So a couple things there that I noticed was the use of what we call safety behaviors. So a safety behavior is anything that we do that kind of turns the volume down on anxiety a little bit. So I'm afraid of flying, but I can tolerate it if, I've got my vodka soda, or I take my Xanax, or if I'm flying with my partner, or if I get a window seat in the front of the airplane. It's all of these things that we do to kind of make sure we can handle the situation. And in the moment, that helps us get on the plane. But it actually may be preventing us from fully experiencing the exposure because we're dialing down the intensity. And so part of what we do in treatment is explore with patients, kind of what safety behaviors do you have going on here? even for folks who feel like, I don't understand why I'm so anxious all the time. I'm not avoiding anything. I'm doing my life. Like I'm taking the flights, I'm going to school, I'm taking the tests, I'm going to work. Often what we find is there can be these subtle safety behaviors that people are engaging in. They feel like it's almost like a crutch. It's like I can go to school, but only if I'm able, like only if my mom responds to any of my texts immediately. Or I can fly, but only with the Xanax. Or I can give a talk, but only if I've gotten a really good night's sleep the night before. It's these little things that kind of keep us in this heightened anxiety loop because we haven't been able to kind of test ourselves to say, we can handle this even without all these safety behaviors. So it's kind of a sneaky little thing, but we pay attention to it in treatment, and it really makes a difference.
Well, it's very sneaky. Actually, I, was working with somebody who, felt doorknobs were contaminated, and we were doing it. And then I learned the person was thinking to themselves all the time, I can do this, and then in a half hour, I can wash my hand. And so, of
Right.
course, there wasn't any real learning kind of going
Yeah.
on here
Right.
because of that, and not really experiencing the transitory nature of those kind of sensations and feelings.
Absolutely. And I think this is like a fundamental misunderstanding is that so often we are measuring success based on how little anxiety appears rather than how well it's tolerated when it shows up. So often I'll have a patient or a family say, "Oh, we did this exposure over the weekend and I wasn't anxious at all. It was actually really easy." And that's great. Like I as a psychologist, like I don't want my patients to be distressed, but I'm also like a little disappointed because we know that the learning happens when something is uncomfortable, right? And so if we're dialing down the anxiety so much to be like, I can touch this doorknob because I can wash my hands, so I'm not actually anxious when I touch it, then that's just diluting the learning. Um, and so it does require us to kind of step up and say, are we willing to open ourselves up to this discomfort and to being mindful of the discomfort, to fully experiencing the discomfort, because that's how we can teach ourselves that we can handle it.
With children, of course, they often have trouble kind of connecting the dots of their experience.
Mm.
Um, and I thought that one part in your book that I thought was very helpful was what you call the post-exposure processing. In pediatric practice I work at, we do a lot of work on needle phobia.
Mhm.
And very often, children will come back in 6 months and they haven't really remembered their success. And, we've been putting a lot of thought in terms of how we help them do that post-exposure processing. And perhaps you could just kind of elaborate on that section of your book.
I'd love to. I think it's really important, and especially with all of us with really busy schedules, it's something that we really try to be mindful of at the program I help lead at McLean, is actually taking time at the end of each exposure group to have everybody process their experience. Um, what did you think would happen? Did what you expected to happen actually happen? Was it as bad as you thought it would be? If it was, how did you handle it? And just general take home, like, what did you learn from this experience? And we know that going through that exercise of thinking about what you've just accomplished, making sense of it, putting it into language, making a narrative out of it helps to kind of solidify the learning that has just taken place. So it takes extra time. You get so many eye rolls from kids who don't want to be reviewing the hard thing that they just did. But we know that it pays off. And so parents can do this, even if you're not actively in exposure therapy, one way to help to build a resilient mindset in your kids when they do something challenging is to be like, how did you do that? Or like, what kept you going with that? How come you didn't leave? Or how come you didn't dial down the intensity of that? Like, what made this possible? You can just drop these questions in out of genuine curiosity. Even if they don't respond to you, the wheels are turning. But hopefully, there's some insight into I was able to do this because I'm more capable than I think I am. Or, you know, I learned that this situation wasn't that bad. And again, this isn't you know, this isn't the miracle that's going to make anxiety dissipate in a second. But over time, you're prompting them to have a narrative about themselves and their capabilities that's framed around what they can do rather than, I could only do this because I wasn't anxious. So that can be a really helpful starting place.
Yeah, I think your suggestions are kind of so helpful. Um, there's one section of your book that I think is really kind of helpful for parents to kind of be aware of when it comes to kind of doing um, exposure kind of therapy, with their children, to be kind of prepared for. And that has to do with the phrase extinction burst, um, which in turn is kind of related to um, the issue of parental accommodation and how parents in helping their children may want to look for how they can kind of decrease uh, participating in the disorder, or in your nice phrase, parent assisted avoidance. And I wonder if you could somehow weave around to kind of talk about that, because I think it's an important element for parents to expect, be prepared for, and make preparations for.
Sure. The extinction burst, it sounds terrifying, right? It sounds like some apocalyptic, like Paleolithic experience. It is a term, it is a mouthful that, people in our field use to describe how behavior that doesn't get the result that you're used to is going to actually increase before it decreases. So I'll give you an example. I, spell it out in my book. When we are at an elevator bank and we want to call an elevator, we press the button, elevator comes, we go in and we go on our merry way. What have we all done when we press the button and the elevator doesn't come? So the expectation that we had when we did the behavior of pressing doesn't occur. We press and we press and we press and we press and we press. And so again, our behavior increases, it accelerates in intensity and frequency until we give up and we take the stairs. So this is that extinction burst, that is the increase in the intensity and the frequency of a certain behavior before we change our tactics. So how does this show up in the context of anxiety? So if a child is in a situation where they feel like in order to move forward, they need their parent to do something a certain way. So I need you to before you leave my bedroom at night, Mom, I need you to kiss me on the forehead and say I love you 3 times. And that calms my anxiety down. If as part of treatment, we recognize that that's actually, despite sounding like a lovely goodnight ritual, if that
Yep.
is somehow actually maintaining a specific child's anxiety and we want to pull back on that, what we can expect, the child is not necessarily going to go happily with that. Anxiety is going to get loud. Behavior is going to get worse before it gets better, right? So if a child who is used to that kiss on the forehead and the 3 I love yous no longer gets that, a parent should be expecting an extinction burst. So the child's anxiety is going to get louder and fiercer for a short time. Now, the big thing about extinction bursts is that we know that they will burst out. That eventually we change our behavior and we take the stairs. But not if a parent gives in. Not if we've been pressing a ton and then all of a sudden the elevator comes. Then we learn that just next time we just need to press extra hard, right? And so when parents are shifting their behavior around a child's anxiety, we need to be prepared that anxiety is going to get worse and it's going to get loud. And if a parent feels like that's too overwhelming and gives in, okay, here's your kiss and your 3 I loves yous, after my child has just destroyed their bedroom out of anxiety and anger. Next time you try to pull away from that kiss on the forehead, 3 I loves yous ritual, you can bet that you're going to have another destroyed bedroom, right? And so I make the point in the book that if parents are going to shift their behavior around anxiety, they need to be prepared to hold firm. So do not tell your child that you are going to change how you respond until you're fully ready to respond in a certain way. And know that it could take several days to several weeks for that extinction burst to ride out. So this is where we think about how parents can make sure that you have your own coping strategies, your own, your own ride or dies, like calling your friends to be able to support you, having a partner who can help you when you see your child's anxiety and distress really increase in a way that makes you feel like you want to cave and give in to anxiety. It's such an important thing. And as clinicians, I think it's really important for us to prepare parents to expect this. It doesn't mean you're doing it wrong if your child gets upset when you change your behavior. But it does mean that you need to have a plan for dealing with it.
And to think of all the ways in which your nicely constructed plan could go amiss and make plans for that.
Totally. I think when we're doing good practice, we're like, okay, so this is the change you're gonna make. Tell me all the ways the wheels could fall off the bus. Like, let's prep for that. And then inevitably something will pop up in an area that we hadn't prepared for, but we do our best to prepare
Right.
for the extinction burst. And a lot of that is self-compassion for parents, and being able to know that you are engaging in this from, with as much coping strategies and coping support as you possibly have. Because changing the boundaries around anxiety can be really, really hard. Kids are going to get loud, and we need to be able to be prepared for that.
And really up the ante. Yeah.
Yeah.
In terms of what they do. We're almost out of time. Your book has so much, and I'm not sure we've really done it justice, but are there any kind of things that, we should add or you'd like to kind of add to kind of complete the conversation?
I think the two key messages that I hope that parents will walk away with is one is the understanding that avoidance fuels anxiety, the relationship between avoidance and anxiety. The understanding of this is so foundational to knowing then how to address it, right? And when we recognize that this is the pattern, that anxiety is going to get loud and pull for avoidance, our job as parents isn't to then, dogmatically stop our kids from avoiding everything all the time at all costs. But it is to see, where can we push back gently against anxiety? And for parents to start by looking for the low-hanging fruit. Is there a situation where I, as a parent, feel pulled to jump in and minimize my kid's distress when it's a situation they can actually handle, even if it's like uncomfortable or inconvenient? I'm kind of starting there because kids are resilient by nature and they often will rise to the challenge when we present it to them.
Right. Well, thank you so much. And
Thank you.
where can people learn more about you and where can they buy your book?
I have a website. People are welcome to look me up. It has information about the book, certainly, but about speaking, and has ways for people to be in touch with me directly through my website. I'm on Instagram, Facebook, all those sorts of places, which is an exposure for me. So,
Well,
but yeah, thank
Meredith,
you
thank
so
you.
much.
Well, thank you.
Thank you for listening to Your Anxious Child. Please leave us a rating and review in iTunes to help us get the word out. If you'd like to learn more and find additional resources, visit us at edwardplimpton.com.